Hi, today we're speaking with Dr. Rene Ramon from Airrosti and discussing managing the pain of stress. We know our employees deal with a lot of pain in and out of the workplace due to stress, and we want to make sure that y'all have the right resources to tackle these pains in all aspects of your life. We hope you enjoyed today's video, and if you haven't already, please subscribe to our YouTube channel. Thank you so much for being here, Dr. Ramon.
Thank you for having me.
Yes, of course. So can we start off by talking about describing some of the types of pain that you treat?
Yeah, there's a wide variety of types of pain that we treat at Airrosti. You have your acute injuries and you have your more chronic-based injuries. Your acute injuries, I think everybody here has had one before. You slip, you fall, you bump yourself. It can be as simple as you woke up in the morning, you turned your neck, and now you've got a spasm. I think we've all been there, you know. Your more, chronic types of pain or habit, things that you do on a habit basis. Would be you sit all day at work, you might walk, we have our patients that are border patrol, those guys are active, they got to apprehend people, so there's a chance for musculoskeletal pain there. Mm-hmm. Your habits, oftentimes will form an injury right over there. Your workout habits too, our runners, our swimmers, our CrossFitters. So it's a variety of types of injuries that we do treat at the office.
Right. Okay. And so from there, like you were saying, some of them do come on quite quickly. Mm-hmm. Some of them do are chronic, and so they take a bit longer. And so generally, I guess you tend to see kind of an equal amount of those, or maybe from people who are sitting all day, like some of our employees, mm-hmm. or those who work in field operations. What would be kind of the majority of the patients that you see?
I really think it's 50-50, honestly. Mm-hmm. Those acute injuries, we're seeing quite a bit of them right now because people got their New Year's resolutions. They are back to the gym, and they haven't been to the gym in a long time. They get really motivated, which is really a good thing. But they tend to ramp up their training a little bit too quickly, Mm-hmm. So they went from being on the couch for 6 months to all of a sudden working out 5 times a week, mm-hmm. or they're running 5 times a week, or they're back in the swimming pool, So they're usually your body's not going to be able to adapt as quickly as your brain does. You're all fired up and everything to get back to the gym. So those acute injuries, we tend to see those at the beginning of the year right now. Mm-hmm. A little bit later on in the year, we'll start to get those people that come in maybe for carpal tunnel syndrome or some lower back pain or neck pain because they sit at a computer all day long and they're typing and using a mouse all day.
Right. And I think definitely this year we'll probably see a lot more people with those acute injuries, I'm sure, because especially with COVID, mm-hmm. Like myself, I can definitely attest to mm-hmm. not having exercised, mm-hmm. unfortunately, throughout COVID. I'm gonna out myself here, but not having exercised throughout COVID, and recently in the past couple of months, I've been trying to kind of get mm-hmm. back into it, and my body is telling me, wait, you're not able to do what you previously did, because before I would do CrossFit, right. I would do like exercise all the time, go running, mm-hmm. and now I see myself having some heart issues where my mm-hmm. heart rate is accelerating really mm-hmm. fast, and mm-hmm. so I can definitely see where that would also cause people to kind of, I can do what I was doing before, sure. And then automatically have those injuries come up.
That's right. And I think the key is just to listen to your body. Mm-hmm. If you feel like you're tired one day, if you feel like you're getting some pain developing something somewhere, that's your body telling you that, hey, maybe you don't have to do that same activity that you've been doing. Maybe you could skip that run today. Maybe mm-hmm. you should go to the pool and go for a little bit of a swim. Maybe you should row. Maybe you should lift weights today. And change things up. If you can vary those things instead of, I am going to run because I used to run 5 miles a day, I'm gonna go right back to it. You ramp up a little bit too quickly, So right. Listening to your body is gonna be a smart thing to do.
Right, definitely. So since we work here at the county, a lot of people in their specific workplaces, may already have habits that have set in for mm-hmm. the year or for, let's say, the past 20 years that they've been working mm-hmm. here. Would you say that there's specific habits in the workplace that can increase pain?
Definitely. You start thinking about ergonomics, and that's mm-hmm. just the situation at your desk, mm-hmm. So, sitting for 8 hours a day, I don't think the human body was designed to do that. If you look at all the muscles all over the body and the tendons and the connective tissue and the ligaments, we really were designed to move. Mm-hmm. So if you do happen to have a desk job, it's a really good thing for you to just go and stand up every half hour, at least for 4 minutes, at least just to give your lower back and your body a break. The typing is also another thing. You want your keyboard right in front of you. You want your elbow at 90 degrees right over here. You don't want to be so elevated, which can cause some neck pain and stress in the shoulders and the upper back right there. We do treat something called cervicogenic headaches. We treat thoracic outlet syndrome. Those are all part of something called upper cross syndrome, and these are all like workplace computer type injuries. You know, you might get numbness and tingling going down the hands and the fingers. Your forearms get really tight from just the keyboarding all day and the mouse work. Your neck, you're looking down, you're looking forward. We tend to lose our posture right over there. So standing up every half hour is a really key thing to do for certain people. And standing up for just 4 minutes. Even better if you could take a walk for 4 minutes and come back. If your supervisor approves of that, that'd be great.
Right, definitely. No, I know we have 15-minute breaks in the morning and in the afternoon, but maybe separating those up into 5-minute intervals and getting up and walking around.
I think anything to just break up, you know, being on the computer for 4 hours and then getting your lunch break, you know, after that.
Yes.
And then a lot of us will go home and sit as well. You mentioned COVID. A lot of things are virtual now. So whether, you know, where you used to have to maybe get up and go meet somebody or drive somewhere, now you're just on a computer. So it's just a lot of computer work right over there. So our bodies are a bit of an imbalance right now.
A lot of screen time.
A lot of screen time. It's a lot of screen time. So tension, headaches, neck pain, those kinds of things we're seeing quite a bit of. Upper back pain, shoulder pain, you know, even numbness and tingling to the hands and the fingers are real common symptoms to have when it's just an increase in computer work like that.
That's super interesting, and makes a lot of sense now that I'm thinking about it. So another thing that we really see a lot, especially with our law enforcement professionals, is stress. Stress in the workplace. If you're working at a desk job, you know, dealing with coworkers on a day-to-day basis can cause a lot of stress. Would you say that stress specifically could be a cause of pain in the body?
Absolutely. We see it in the office. You know, people come in, you know, we get to talking about the history of their injury, but you know, once we start treating them, we start talking about what's going on in life, and there's a lot of times where, hey, you know, work has been tough right now, a family situation, you know, anything that's going to put a person in an increase in stressful situation and mental stress, they're gonna increase their probability of having an injury. So, you know, some of the best stress management things that you can do is do something that you enjoy. You know, if it's a hobby that is only for you, you know, do that hobby. That exercise is really important. You know, at least exercising 3 times a week for 30 minutes is great. Going for a walk, getting out and getting some sunshine. You know, cutting back on a lot of the bad foods that we tend to eat. You know, a lot of the sugar, a lot of those inflammatory type foods right over there. And then getting your rest, you know, trying to get a minimum of 7 hours a week. That's really challenging for a lot of us because we got Netflix and all these wonderful things to help occupy. But your brain needs a break and you need to recharge your battery too. So, you know, starting with just those things right over there can help you deal with a lot more stress from the workplace or just at home.
Right, definitely. And going back to screen time, I think definitely like if you're sitting at a computer all day, okay, then you have your phone. So you're going home and you're kind of taking some time to be on your, like, I'm gonna de-stress, but your de-stressing time is just more screen time.
More screen time, right.
And then you're like, oh, well, it's family time. Let's spend family time together. Okay, let's watch a movie. Okay, so then that's more screen time and you're just kind of like hunched over like this. And so I can definitely see how that everything just kind of adds up, you know?
Yes.
And I think now we have that feature on our phones that tells us like, oh, it's much screen time, and sometimes on the weekends I look at it and I'm like, oh gosh, maybe I should put this down for a little bit. So talking about, you know, stress and pain in the workplace, if somebody is experiencing maybe some shoulder pain, neck pain, how would you advise them to assess that and then kind of decide, okay, maybe I should go see a doctor about this? Right,
so I think, you know, I like to tell my patients, if you've had some pain that you've been experiencing for about a week and you felt that it's just stayed the same, it's not improving or it's getting worse, then go get it checked out, you know. You know, at Airrosti, we're going to do our evaluation, our history, and if it's something that we can treat, we're going to have them get treated that day. We'll do a treatment plan for them. It's something that we think it's a little bit more far gone. It's too much of an injury for us. It might need some surgical consultation. We're going to make that recommendation as well, you know. But just doing a little bit of maintenance on yourself, which I think the musculoskeletal system is neglected. I mean, we, you know, we do take a shower every day, we brush our teeth, we floss, we do all these things to maintain our body, you know, maybe on the outside, but we're not maybe doing so much to maintain our muscles. And you're covered in muscles, we got to move all day long. You know, things like foam rolling, things like using simple lacrosse balls, stretching, you know, a little bit of exercise is going to be great. Yoga is fantastic, you know, because you get all these stretches and poses where you are, you know, you're getting stronger, but you're getting, you know, more flexible at the same time.
Right.
And you're able to tolerate a little bit more stress and strain on the body there.
So talking about really taking care of the body, how or what are some practices maybe at the office, you know, sitting at our desk that some of our employees can do to kind of take some pressure off the pain that may be experiencing? Let's say, like, I know I'm sure like a roller on the foot or on the shoulders.
So we use a couple of mobility tools, you know, in our office, and one is a foam roller, one is a lacrosse ball. The lacrosse ball will probably be a little bit more convenient to have inside a desk, an office situation right over there. But you could use a lacrosse ball to do a little bit of self-myofascial release on the forearms to help you with any kind of stress and strains from too much computer work. You can simply stand up, go up against the wall. If your mid-back is hurting, you could place it between the shoulder blades and do a little bit of work. It is so simple. You know, we sell our lacrosse ball for $4. It is an easy, simple tool to use and master. There's all kinds of videos on YouTube on how to use these things. The same thing with the foam roller. If it's a lower back situation, you know, the foam roller is only 2 feet long. It's a cylinder of dense foam that you can use on the floor. It might look a little funny to your coworkers, but you know, you're going to be getting the relief that you want right over here. So those are all things just to help manipulate your fascia in a positive way, to keep it a little bit flat and stretchy, and to create some mobility. And again, just to get a little bit more flexibility into the body. There's strength exercises that we would teach our patient that's a little bit more specific to their injury if they were to come in and see us as a patient.
Awesome. So with the lacrosse ball and the foam roller, those can also be used outside of the office, obviously, if you're at home. Is there any other tools that you would recommend, you know, for outside of the office? Like you could get so specific nowadays with Amazon. There's all kinds of mobility tools. You know, we only really use just the foam roll and the lacrosse ball for mobility purposes in our office. The other side of rehab is going to be TheraBands, and the rest is just body weight exercises that you can do to help strengthen up your core, you know. So just a TheraBand will probably be the only other thing that we use in our office. It's real simple, it's super cheap to do, but you can offer a lot of resistance training for a particular muscle, and you can target that muscle. It's about finding out what muscle needs to be released and which one needs to be strengthened. That's really all we can do to a muscle, is get it tighter or make it loose. And that's it. In the right combination, you're going to be able to fix people up. And I think, I mean, those options are really great because they are so accessible.
Very accessible.
Especially, obviously, the body weight movements, you know, so.
You don't need an expensive machine or device or anything like that. These are things that could be done, and it's designed that way. If we show you something, how to do it in the office, or if we're at like a little seminar, we show you, hey, do this and do this for low back pain. You know, those people can easily go home and create a little bit of a nice habit of doing that particular exercise for cheap, really cheap.
Absolutely. So I know you did mention briefly previously about inflammation in the body. Are there any specific foods or beverages to maybe avoid or gravitate towards that can affect stress or pain? Or
sure.
like that in the body?
The less inflammation in the body, the better it is for everything. I mean, really, inflammation is the root of all evil when it comes to any kind of damage to the body. Some people it affects their muscles or joints, other people it affects their nervous system, other people it's an organ issue, you know. So the foods, you know, right off the bat is just avoiding sugar, you know. It's obviously, it tastes great and desserts are awesome, we all love it, candy and gum and everything. But if you can avoid sugar, you're going to decrease your body's level of inflammation. You know, I think we could cut back on our carbohydrates a little bit, you know, and it's you know, it's a staple in our diet. You know, you go anywhere around here and there's carbs, and there's carbs everywhere, you know. So leaning a little bit more towards, you know, like a ketogenic diet, I think is a good anti-inflammatory step right there. So getting the proper sleep and of course exercise, those are all things to help us cope, you know, and manage our levels of inflammation. If you could reduce your levels of inflammation, it just means you're going to be less susceptible to having some kind of musculoskeletal injury.
Right, definitely. And I'm sure sleep is definitely a really big...
Very important. Yes. And it's often the most neglected.
Yes, definitely. I can definitely see that. Because like sometimes if I don't get a good night's sleep, I wake up and my face is just so puffy.
You're all puffed up.
Yeah.
Exactly. You know.
Yeah. So I can imagine what the inside is like, right?
Exactly.
Like,
just everything is inflamed.
Right. Yeah. Definitely. Well, awesome. I'm really glad that we were able to have you here. So before we wrap up, is there anything else that you would like to say to our viewers? Just kind of a... tips or anything?
Yeah, I think, balance is the key, right? I mean, if you have an office job, and I would assume most people here are going to have some kind of an office job right over there. It's just, doing the opposite of that, which is just moving a little bit more, They do say that, sitting for 8 hours a day is the new smoking, And some research says that even if you sit 8 hours a day and you still get your 1 hour gym time, you're still hurting yourself during that 8 hours. So just breaking up that 8 hours of sitting, just by standing up, just by trying to walk around a little bit, just to break that position right over there, it's going to help increase your heart rate. It's going to help get things moving in the body a lot better. So much better for your posture right over there. I think managing stress, trying just to do those basic things. If you do all those little basic things, like the diet, the exercise, the sleep, a little bit of flexibility work on yourself, you could prevent a lot of these musculoskeletal injuries from happening. But keep it in mind, if something is bothering you for more than a week, it's time to really get that checked out. Don't let that small thing become something so much bigger.
Right.
Don't let a shoulder problem become an elbow, wrist pain, and now my neck hurts.
Right.
Now the whole arm is hurting when you used to have maybe just one part that could have been easily managed, a few weeks ago.
Yeah.
Not letting those things get out of hand.
Right, definitely. And I feel like maybe certain people might be like, oh, I don't want to go to the doctor.
Yeah.
And it's like, okay, well, let's manage that one small issue first before it, like you're saying, before it turns into this much larger issue.
That's right.
But yeah, definitely. Well, thank you, Dr. Ramon, so much for being here today. We really enjoyed having you here and having this discussion on pain and stress in the body. I'm sure our viewers are really going to enjoy it.
Thank you for having me. I really enjoyed it.
Awesome. Thank you so much to our viewers for watching. If you haven't already, please subscribe, and we hope you really enjoyed today's conversation.